Welcome to Visions for Health. I'm Dr. Wendie Trubow, and I'm delighted to have Lee Graham, the president of the Healthy Villi Association, here with me today. Welcome.
Thank you.
Thanks so much for being here.
Thank you.
So talk to me, the Healthy Villi, what does it do?
Well, we're basically a support group that educates people who have to be on a gluten-free diet or have celiac disease. Those can be two different things. But mostly medically, if you need some help figuring out what you need to eat, then that's where you want to come to our meetings.
So you're a resource for people in the realm of gluten intolerance or celiac disease?
Correct, that's right.
How did you get involved?
Well, I have celiac disease. I had it as a baby, so I've had it for a long time. And I had a friend who said, gee, I've heard about the Healthy Villi, let's go to a meeting. And so off we went, and I was very impressed with how they organized it, and actually also thought I could do some things that might help them organize a little bit better. Since I've been in the nonprofit area for most of my life, that was my love. So I joined up as a member and then became part of the board, and then next thing you know, I became president.
How long have you been president?
About 5 or 6 years. I felt it was the right time for me to match the needs of the group. I think in the past we've had other great presidents who have had the right talents at that time for what was needed, and I just felt that this was the right time for me to be sort of running the whole thing.
So how old is the Healthy Villi?
We're 20 years old. We started with 6 people in a living room, and now we're about 900 people and probably touch the lives of about 2,500 people every couple of years.
That's a lot of people.
It is.
2,500 unique people, meaning every couple years you've taken care of, touched, cared for another 2,500 who are unique from that other?
That's correct.
Okay.
Yes, we're like a revolving door. I think people come in and they want to learn the diet, and for the most part it might take them a year. So they come to meetings, they come to our larger meetings, they come to smaller monthly meetings, and then they seem to get it. And so they might stay as a member more as a social thing. They've met friends, they feel comfortable together. They know when they eat food at our meetings they'll be safe. So they may stay or they may not, but then almost at every meeting half the group that's there is brand new. So we revolve through.
How do people hear about the Healthy Villi? I mean, your friend told you.
A friend told me. I think that's a great way that most people hear about the Healthy Villi. Sometimes they hear from their doctor or their registered dietitian. Sometimes they go online and look up groups in the area, and our name would come up obviously in the New England area.
So how do you have outreach to physicians and dietitians so that they know to refer people to you?
We do. I think we'd like to have more dietitians and doctors be there to tell us, tell us they've got some patients that they'd love us to see. And I think in many ways in the future, there may be less time that the doctors can spend with their patients when they're diagnosed with celiac disease or gluten sensitivity. And I think we'd be a wonderful augmentation, not taking over what they do, but to be able to support patients when they can't get back to the doctors. And I think that may be happening in the future.
So you mentioned you were diagnosed with celiac as a baby. That's extremely rare, I would imagine, especially even 20 years ago, celiac was not, I would say even now, celiac's not really in the forefront. So how did you get diagnosed? What was going on for you?
Well, it was way back, a long time ago, before you had any of the blood tests or the biopsies. So basically it was a guess. And once they guessed that it was celiac, then they guessed at what the diet was, which inadvertently did not have gluten. So, which is oat, barley, and rye, wheat, oat, barley, and rye. So here we were, I was on a diet of, liver, egg whites, bananas, and I think a lot of people called it the banana diet, which I was on for 3 or 4 years, and then they said I got well, and that I'd grown out of it, and then I was fine. So I do remember going to school with stomach aches. I was very small for my age when I was little.
Can I stop you for a second? So when they said you were fine, does that mean you started eating everything? You started eating all foods, including barley, malt, rye,
you
oats,
name it.
Wheat. Okay, so you ate everything. You were probably excited to eat everything.
I don't know. I don't remember that far back, but it was, I just became, my diet was normal.
Okay.
So, but I didn't feel well. And yet it was either, oh, gee, you're probably nervous about going to school or whatever. But I think there were signs all the way through that when I look back, probably indicated that I never grew out of celiac disease. I've always had it. So that was sort of too bad, but then again, there was nothing we could do medically to
So when
change
were
that.
you re-diagnosed?
I was re-diagnosed in my late 40s when I really felt sick. So probably for 40 years, I was on a gluten diet.
Yeah.
And not realizing that that was the wrong thing.
So you were sick for 40 years.
Yeah.
And
Yeah.
did you complain during that time, or did you just, because it had gone on so long, feel that this was how it was supposed to feel?
I thought it was normal. I thought feeling the way I did was normal. I just couldn't gut it out as well as other people. And I was really jealous that other people had all this energy and could do all these great things. And I would try and do the same thing, but then I just have to go to bed. I was exhausted.
How did you raise your family?
I don't know.
Sheer grit,
I just
right?
did, yeah.
Okay.
Yeah, you just did what you had to do, and you didn't know that there was anything wrong. You figured everyone else had to do the same thing.
So talk to me about the symptoms of celiac disease, because I think, I said to someone, oh yeah, celiac disease, have you tested your family or friend? And they said, well, they don't have any stomach ache. And you had a stomach ache. But that's not the majority of people.
Right, it isn't. In fact, I think because the symptoms are so broad, it makes the disease hard to diagnose. So I empathize with the doctors trying to diagnose this disease. There are some symptoms that do run through many times, like anemia could be seen, but there are also people with no symptoms, and yet they're hurting their gut. And that's the key here. No matter whether your symptoms are severe, a few, but some are anaphylactic, and that's scary.
Yeah.
Others have no symptoms at all. So you run that pendulum swing all the way from one end to the other.
And you mentioned you were short as a child, because I know that short stature or developmental delay or growth delay
Yes.
is also associated with celiac.
Right, right. I am the smallest in my family.
Are you the only one with celiac?
I am.
Amazingly.
Yeah. I figured I could just tell there were going to be other people that were going to be diagnosed. Yay. I was going to have company. Didn't happen.
Nothing.
No.
Got it.
Which is fine. But I do feel that because the symptoms are so broad, it's really hard to diagnose.
Yeah.
But I also would love to see more doctors have that in the front of their minds to look at celiac disease, run that blood test, which is really simple to do, just to see if their antibodies have been built up.
Yeah, you're talking about the tissue transglutaminase.
Yes, that's right.
It's a cheap test. It's like
It
$70.
is. Yeah. So I'd love to see that happen more often.
So why is it called the Healthy Villi? Can you say anything about that?
I'd be happy to, because it's an
You
odd
get this question
name.
a lot, right?
Yeah, who on earth is it? And how do I pronounce it? But it's basically, you have villi in your intestine that take, excuse me, that take in all the nutrients that you eat in your body. And the villi are the important things that transfer all the nutrients into your body. So therefore, if they're not healthy, they're not doing you any good. So our goal is to have healthy villi. When you eat gluten and you are celiac, you damage the villi. So we want to prevent that from happening.
Yes.
Yes.
We do. I was reading that one exposure to gluten in a sensitive individual can damage the lining for up to 3 months.
Yes.
So you referred to anemia. I know that it spans not only anemia, which is iron, but B12, folic acid, calcium, osteoporosis, infertility. It's amazing, the span.
It's insidious.
For what occurs.
It's insidious what it can do.
Yeah.
So I think there are many times I have more questions than answers. The scientific studies don't always cover all the things that I'd like to know about or that I run into with people asking me. You know, if I eat a teeny amount of gluten, how much is that damage? I don't think they know.
We don't know that.
And I don't think they know, for some people, how long it might heal. It may be less, and for others, it may be more. We don't know that as well. So there are a lot of questions that are still out there.
It's amazing. Now, how how often can someone be involved with the Healthy Villi? First off, what's your website?
Our website is www.healthyvilli, which is V as in Victor, ILLI.org.
Okay.
And you're welcome to come on our website. We update it almost daily. There are things that are going on out there.
Okay.
That whether it's recalls of certain products that they found gluten in, or whether it's updated medical meetings that might be discussing celiac disease. There's a lot of different things on the website.
So there's a lot of resources there.
Yeah, yeah,
Okay.
absolutely.
So once someone goes to your website, if they want to go to a meeting, if they've been newly diagnosed, they go on your website and it tells them when the meetings are?
Yes, yes,
Okay.
definitely. We'll get our schedule of meetings. Some events are happening that aren't connected with us, but most of the time, it's our events that are out there.
And you just had your annual expo.
Yes, we did. We had over 700 people attending.
Amazing.
And I think the most popular thing out of the day, other than, of course, your workshop, which was terrific. Thank you so much. But the gluten-free food truck was something that people had never seen before.
How many people visited that? Do you know?
Quite a few. I would say 500 may have visited.
My goodness.
Yeah, amazing. So they were thrilled, the food truck was, and we thank them because they took everything out of their truck, washed it down, put everything back in, and had only gluten-free products in there. So we knew people would be safe when they went to order.
So are there people who are sensitive to small amounts of gluten? And how do people navigate that?
I'm not sure I understand your question.
Are there people, so you mentioned they took everything out of their truck, they washed it down. Is that because surfaces that are contaminated can be a problem for people?
Yes, definitely, definitely. I can't visualize the amount of gluten that could damage us, but it's small. It's very, very small. So yes, I think, but then again, I've had somebody say, well, somebody told me I had to get rid of all my plates and all my napkins and all my spoons. And she said, I just don't think I can follow the diet. It's too difficult. And so there has to be a balance there. We don't think you have to have separate plates. If you wash your plates, you should be fine. Many times we recommend your own strainer, because sometimes those are difficult to strain noodles out of and get all the gluten out of it. And sometimes a toaster helps. But I think you have to be just practical about it. You don't have to be insane. One of the sneaky things I think is double dipping knives into peanut butter or mayonnaise.
I was just going to say, I have a good friend who has not been diagnosed with celiac disease, but is excruciatingly sensitive to gluten. So I would kind of presume that she's on that spectrum pretty close. And her partner does not eat gluten-free, and they've been sharing mayonnaise, peanut butter, anything that's dippable. And she says, I'm sick.
Yeah, no kidding.
So it's funny you say that.
Yeah, I think it's one of those things you just don't think about, and people who don't have celiac wouldn't really even decide that that was a problem. It would be, oh, well, it's no big deal, it's just a knife, it's nothing. So a lot of times when I'm with people that don't get the disease, and I'm not going to do a training on them, whether it's company, personal things, whatever, I just find it's easier to get the squeeze bottles of ketchup and mayonnaise and mustard, and then I'm done. I know I'm safe. Yeah.
Or individual servings.
Yes, individual packets of things is also helpful. Yeah.
I mean, do you eat at other people's houses, or do you bring your own food? I
eat at other people's houses, and what I found is some houses get it. Some people, I don't even have to say much, and they just get the diet, and it's wonderful. And those people I love to go visit. I know I'm going to be safe. And there are other people, as much as I love them dearly, they will never understand. I will see crumbs on my plate, and I'll say, what is this? Oh, I put the hamburger roll there by mistake, but I moved it. I said, well, I can still see crumbs. Yeah, well, you should be fine. Or an hors d'oeuvre platter with gluten-free and regular crackers all piled up together, and they just don't get that is a no-no.
Got it.
So as much as I love those people, it's a sticky wicket to go to their place to eat. And I'm usually really, really careful. Either I bring something or I just eat ahead of time and just eat very sparingly there.
So does the Healthy Villi help people with this type of challenge? I mean, do you have, instructions for people to give them, or any literature, something they can print out to say to their friend, here's what you should not do?
We do. We have a welcome packet that everybody gets when they are a member of our group. And there's a lot of tricks and hints, but we also wanted to keep it very simple. It's awfully hard to wade through a ton of information.
Right.
So we find that our small group meetings are really the best vehicle for that kind of information. Everybody has different hints and ways that they've gotten around certain things, and to share all those different ones is really helpful. I think a lot of times what you're going to do and how you handle it is how your personality works. So if you're a particularly dominant person, you may have a whole different way of handling things, either at someone else's house or a restaurant, where somebody who might be more reserved would find a different style that works better for them. So really finding your own way of getting the message across is something I think is a journey for everybody.
I could imagine, well, not even imagine, I know that sometimes it's difficult to be the odd man out. And that's probably a big challenge for people in terms of going to restaurants and being different, going to a party and being left out, or going to a family event and not being able to participate fully.
Yeah.
It seems like the emotional component may be something that people do. Is this something people do in the small groups, is talk about navigating not only the food, but the emotional component of it?
Absolutely, absolutely. I think there's so much that's emotional about eating, number one. And it's social, so you're with a lot of different people. So you have all sorts of dynamics that can be going on when you're with people for a social event that includes food, which is most of the time.
Life.
So yeah, it is. So I think that's very difficult. And I think the small group meetings many times give people a soapbox to sort of vent on some of the things they've run into that have been difficult.
Yeah.
And the people that are there many times will come up with some neat suggestions, which is nice. On the other hand, there's been a study out that showed that the most burdensome difficulty or diseases for many people, celiac disease came in next to dialysis. Dialysis being the most burdensome disease to have. And this was over heart disease and cancer, which appalled me. But I think it is very
societal.
difficult. It is. And when you make a mistake and you get sick, which we all do occasionally, unfortunately, you feel very guilty because it wasn't the doctor's fault, it was your fault in some way. So I think you carry that burden. And I also think, because as we talked earlier about everything being so social, it's do you stay away? Many people I know who have celiac just don't go to restaurants. They just don't go out. They just stay home, which I think is sad, very sad.
Right, it's isolating.
Yeah.
So who leads the small groups?
We have different board members. We have 8 small groups, and different board members lead those groups. There's no agenda. It's come and do whatever you need to do, just talk about whatever you need.
Do you have to have celiac disease to come?
No, you don't have to.
Is there a fee for coming?
Nope.
So
no
it's
fee.
a free group, and you could be gluten sensitive or gluten intolerant, or have a family history, or just want to know more.
Absolutely.
All comers.
Yes.
Okay.
Sometimes we have children of older members that come to try and figure it out so they can help their mom and dad.
Okay.
It doesn't matter. We really don't care.
And then are you affiliated with any particular hospital system or group?
Not really.
Okay.
We like to be collaborative
Yeah.
with different hospital groups, and obviously we adore Visions. We think you guys do an amazing job.
Thank you.
And we also work with Mass General, Boston Children's Hospital, and BI Deaconess.
Got it.
So,
What's upcoming and what's hot in the world of gluten and celiac?
well, there's lots of studies out there, which is very, very exciting, and we'll see how those all pan out in the next few years. Meanwhile, just from our standpoint, we are doing collaborative with BI Deaconess, Mass General, and Boston Children's Hospital on a gala event at the Gardner Museum in December.
When is that?
That is December 11th, Wednesday at 8 o'clock. And if you want to come to the VIP reception, it's at 6:30. You can certainly get tickets online, www.healthyvilli.org.
Okay.
But it's more because we want to become a community. We really don't have as established a community of celiac disease and gluten sensitivity as I would like to see us have. And I think we all need to work together. It takes a village, and I think we need to hold some hands, and I think this is a way that we might start to do that.
It seems like the timing is good. Everywhere you go, there's a gluten-free menu, a gluten-free gluten-free store, not store, but products, and it's all the buzz.
Yes,
so
exactly.
The timing seems really good.
It does seem good. I mean, there's a plus and minus to people going on the gluten-free diet because they're going to get healthier, or they're going to become an athlete, or they're whatever it is. I don't know, all these different reasons people are going on gluten-free diets. God love them. But basically, that can work against us as well as in our favor. We have found that certain restaurants get used to somebody who's on a gluten-free diet that's not medical, that they'll order gluten-free, they'll make a big deal out of it, and then they eat a roll. Or they'll have dessert, which is a wheat-loaded cake. And so then we come in and say we are on a medical diet for celiac disease and we need to be very careful. They don't understand that, and I don't blame them. It'd be very difficult. So the restaurants are getting a mixed message, which I think is scary.
So it's like wolf, too much wolf.
Yes, too many crying of wolves, yeah. It's tough. So I think we need to work on that one and figure out ways that we can make sure people understand how important this diet is for us and that it is medically necessary.
Got it.
Yeah.
It's such a rich field.
It
so
is.
much. So what else is coming up for the Healthy Villi? I know the gala event in December.
We have that.
One.
We have a meeting February 1st, and that is at Regis College, and that will be a bunch of different workshops. We always do a newly diagnosed workshop for people who are newly diagnosed and feel like deer in the headlights. They're welcome to that one. It's a great one. And then we're going to do a couple of cooking demonstrations. So,
great.
Yeah, we have someone coming in to talk about the different kinds of flours you can use and what results you get from them, which I think is helpful. And then we'll have someone else who does more savory items. And although I don't know specifically what she's doing yet, she's working on it now. So she's got a following. This is Jillian O'Callahan, and she does wonderful work. So she'll be there as well.
Where's that being held?
Regis College in Weston.
Is that also on your website if people?
That is not ready to sign up for yet. We're going to do the gala at the Gardner first, and then we'll be doing the February 1st. And then after that, we're doing a New England Celiac Conference in April. That'll be April 13th. And we will have 3 of our favorite doctors, which is Alessio Fasano from Mass General, Dr. Kelly from BI Deaconess, and Dr. Leichner from Boston Children's. And partly, excuse me, partly the reason we have them is that they've just started a celiac program at Harvard Medical School. So they will be doing a lot of studies themselves, although clinically they'll be seeing people in their own hospitals. But it's the research part of it that I'm really excited about that they're doing.
That's amazing.
Yeah, and the fact that they're so collaborative about it.
So it's the celiac program at Harvard Medical School?
Yes, and that has just started up. So they'll be coming to us in April, and that will be at the Sheraton in Norwood. So we expect about 700 people.
And is this for the general public, or is this for the medical facility?
It's for the general public. It's members will probably get a discount, but anybody is invited. And
they'll be speaking?
And they'll be speaking. And we'll also have workshops, we'll have vendors, and we'll have some meals that are gluten-free that people can enjoy without worrying about.
Very nice.
Yeah, so we're excited about it. It's a good program for us. Yeah.
Yeah, and then it sounds like the only thing that might not be fleshed out is how to get the medical community and the dietitians more aware.
Yes. Yes, I think that's an area we really need to work on.
Yeah.
Come up with some kind of a program for that one that's a little more concrete than what we have. We had one year we invited about 300 registered dietitians throughout the year and just said, come to a meeting as our guest. We'd love to have you, see what we're about, see if we all agree, if we're on the same page, and see if we can help each other. And that worked out very well, but I think it needs to be ongoing.
Yeah.
Yeah.
All right. We have only a few minutes left. Is there anything that I didn't ask you that I should have asked you, or that you want to particularly point out before the show ends?
Well, I think you're nice to ask that question. There are a lot of things that I'm very proud of with the Healthy Villi, and we have over 60 volunteers that help us. We have a board of 20 plus people that give their time once a month, as well as other times that they volunteer, and also our executive board. So it's a very healthy organization for Healthy Villi, and I'm proud of that. I'm really proud of the people that are there and doing the hard work and not getting paid. This is all volunteer.
This is a not-for-profit?
Oh, absolutely.
So
yes.
People, if they wanted to donate, they could donate to the Healthy Villi?
Of course, absolutely.
And can they donate on your website? Is there a button?
They can definitely donate on our website, yes. No, we love donations. Who doesn't?
Right, free money.
Exactly, yeah. No, there's always a need for more programs, being able to really branch out into other areas that we haven't yet. If we had the resources, we'd be doing that. So, yeah.
No shortage of projects, only a shortage of time and money.
Exactly.
I know the feeling.
Isn't it always the way?
Yes.
Yeah, but thank you.
Thank you. I mean, really, Lee, thank you so much for coming on the show. This has been awesome.
Good.
And what I think, I think there's so much out of this that people can get practical tips, come to meetings, come to the expo. They can come to the Isabella Stewart Gardner Museum in December.
Yes.
And they can get tickets for that on your website. And then in February and April, there's a lot of events coming up.
We have a lot of events coming up.
Okay.
Yeah, so it's very exciting.
Yeah, there's really a lot available for support for people.
Yes, it's there. We'd love to have them. Yeah, thank you.
Thank you. Thanks for joining us for another episode of Visions for Health. This is Lee Graham, the president of the Healthy Villi organization, and we'll see you next time.